Hi, I'm Dr. Ara Duke-Majan with the Duke Spine Institute, and I want to take a moment with you today to talk about painkillers for treating back and neck pain. Painkillers are frequently used by primary care doctors when patients have back or neck pain. Painkillers are fine to use for short periods of time, as long as their use is controlled. Patients with back and neck pain lasting longer than 6 to 8 weeks will probably not get better on their own, even with the use of painkillers. When painkillers are used to cover up symptoms rather than treat them, this can lead to problems, such as addiction, difficulty at work, or interpersonal relationships. I can't tell you how many patients I've seen in my practice that are on painkillers for months, if not years, treating back and neck pain. Back and neck pain that actually has a cure or a treatment that we can render to get rid of it and get these patients off the medications. Most of the patients who have been on painkillers for years typically have a depressed life. They're unable to engage in normal social activities. The painkillers interfere with their ability to think and perform at work. The painkillers also affect their interpersonal relationships, and loved ones often get frustrated or aggravated with their continued use of these medications. Patients suffering with chronic or long-term back and neck pain can be cured with certain treatments, but to make that cure, we have to make a diagnosis first. Covering up pain with pain medications doesn't help with that process. Patients with long-term back and neck pain need to be evaluated by their physician, a physician who's competent in making a determination of what the cause of the back and neck pain is. At the Duke Spine Institute, that's our specialty. We're able to determine what is the cause of your neck and back pain and then fix it rather than cover it up with pain medications. Every day in Florida, 7 people die from prescription narcotic painkillers. And that's just in Florida. That's a staggering number when you think about it. The number of addicted individuals in the United States to painkillers as a result of chronic neck and back pain is also staggering. Recent research tells us that painkillers are not the right way to treat back and neck pain. Getting to the source of the pain, what's causing it, and treating that condition is. And in over 90% of patients with back and neck pain, there is a cause that is treatable and curable. It requires the right doctor to make the diagnosis and the right physicians to render treatment. Frequently, it only involves behavioral modification, changing what you do, or getting into a good physical therapy program. Sometimes it requires injections, and rarely it requires surgery. But there is a cure to back and neck pain in over 90% of patients' cases. There's no reason for you to continue taking pain medications to cover it up. Some of the toxic side effects of pain medications include nonsteroidal anti-inflammatories that can cause kidney failure, stomach ulcers, gastritis, and also can increase your risk for stroke or heart attacks. Narcotic painkillers cause addiction. They cause behavioral problems, memory loss, depression. Please, I ask you, if you're suffering with chronic neck or back pain, consider being evaluated by a physician who's competent at determining the source of your pain. Get your problem fixed. Stop covering it up. You owe it to yourself and the people that love you and care about you. If you'd like more information about our treatment options for your condition, please visit us on dukespine.com on the internet or call us at 1-800-FIX-MY-BACK. I'll personally review your MRI scan and call you to discuss your treatment options with you.